inner cannula.
Okay, now you can contaminate one
Watch me.
hand
This is
by
going to be my dirty
pouring
hand. This is my sterile hand. So I can touch the airway, touch all the tubing and stuff. This is disposable cannula. I toss it, and I would grab my other one and put it in. Okay, but we're going to say this is one that we have to clean and put it back in. Okay. Now this part here is open to the air, and so that's kind of the dirty part. This is the sterile part that's on the inside of the airway. This is the part that I don't want to touch with that hand, but I can touch with this hand. Okay, remember? Sterile, sterile, dirty to dirty. Okay. Now normally what you're going to do is you're going to put it. This is my hydroperoxide side.
This is clean, right? It's sterile. And grab that. Now that's your contaminated hand, right?
Instantly, you're going to see it bubbling up. You're going to
control that catheter, so grab it in your sterile hand.
You're going to clean the sides.
The whole thing.
And you're going to see all kinds of secretions and stuff on there. So you're just going to keep doing that until you get all those secretions.
With your contaminated hand, connect this to the tubing.
Go on this side. And then after you get all those secretions off of there, then you're going to dip it in the saline. Now did you notice in the video, she actually dropped it in there, changed her gloves, put another set of gloves on. I'm showing you a way that where you can use the same pair of gloves. Where
the catheter with some saline. So stick it in the saline.
So you clean it with hydroperoxide, dip it in the saline, tap it on the side.
No, just a tip.
And what you're going to do is, when you stick these in here, you put it in from the side.
Apply the suction. There you go.
And then once you advance it down,
suck it in.
So far, then you twist it back, and it's going to lock. Now
You
notice that this one has a flange here that you shouldn't touch it with this hand because it's much down. You pinch it right here, and it locks here on the side. The other ones that they have on the other trachs, they have a little flange here that you turn. There's two little blue dots. When those blue dots are lined up, it's locked. You twist it, it'll unlock, and then you pull it out. Okay? So it goes in sideways until you get about halfway back, and then it twists to the side and make sure that's locked. Okay? And then you burst them back up to oxygen while you do the cleaning. So now at this point, everything that is sterile is done. Everything that we're going to do now on trach care is on the outside, so I can contaminate my gloves. I'll still use them, make sure they're clean. But our goal now is, we didn't have a fenestrated cuff on there. We would have taken that off. We're going to grab saline-soaked cotton tip applicators, and we're going to clean the stoma, the site where they have the hole in the skin. And you're going to clean it around, toss it, grab another one, do it from both sides. So you're going to clean all around the stoma, toss it, grab another one. You're going to clean the outside, because they're going to have all kinds of dried secretions and stuff on that. Toss it, grab another one. You're going to clean all this tubing. Once everything's cleaned up, did I say that was hydroperoxide? Okay, so you were using hydroperoxide. And then once you've done the hydroperoxide to clean, then you're going to dip it in saline and rinse. Toss it, dip it in saline, rinse, toss it. Okay? So everything's all cleaned up now. Toss. Then you're going to grab the fenestrated tray. Okay? It has a hole already, a slit already in there. Never take a pair of scissors and cut a 4x4 because you'll have little strands and they could impale that. This is already pre-made. And if you have big fingers like me, you'll want to use a cotton tip applicator or a hemostat to get this underneath here. Because, like you guys were asking a little bit ago, the more you manipulate this, the more uncomfortable it is for the patient. So these are a lot thinner than my big fat fingers. And so slide these up underneath here. Here they call these rabbit ears.
Okay, so stay out of the line of fire. Okay? Don't be directly facing that tracheostomy tube. Sometimes patients are turned.
The trick is you want to get this underneath this.
So that they're going to be facing you. Make sure you have a gown on.
It's right here where this faceplate here, this hard rubber or plastic, we don't want that to come in contact with the skin.
So that if they do cough at you, it goes right here and not in your hair.
Slide this up underneath here.
would it be a good time to do oral care?
A lot of
To do
people
what?
are
Oral
going
care,
to
like when you're suctioning, they get like little swabs and stuff, and do since you have the
Oral suctioning?
yeah, to do.
You can. They
Just
tag
tag
it on
it on
here.
Okay.
Just once
And
to
then
show.
make sure they have oxygen on it.
Because we don't want.
Okay, so that's trach care. Now, in the video they showed you, you can change these trach ties, but make sure you have another person that will help you do that. Most of the places that we go in the hospital will have the Velcro, and it's a lot easier. On these, you have to feed it through one side, tie it, feed this back underneath the neck, run it through and tie it, and you always check it to make sure it has one finger width. And you can see this one here is way too loose, and the person can pop that out.
Which is better for the
Okay, so the next two people can suction.
The Velcro is a lot easier. The problem with these, because you're tying and stuff like that, you're moving it around and it's more uncomfortable. The Velcro, this one, the Velcro must be shot. You slide it in and it Velcros right there. You don't have to do anything. Good question. Okay, any questions at all?